and welcome to Astor Perkins All Things Space and Survival October 2nd event. To help kick us off, we have Dr. Jim Flatt, who will present the keynote for this track.
A new advance in continuation of improvement in longevity is really through personalized health and precision molecular nutrition that is the primary approach to address chronic diseases, including diabetes, cardiovascular health, and liver disease that actually now represent the things that are our predominant cause of premature death, and also actually compromise the quality of those extra years that we now can benefit from. Diet is the single most important determinant factor in longevity. A poor diet is responsible for 1 in 5 premature deaths, and it actually exceeds all other causes, individual causes for the outcome.
Investor Roundtable panelists. Greg SHEPARD is the founder of Boss Capital Partners. He's an active investor. SERGEY is the founder of the $100 million Longevity Vision Fund. Alex Fair, MS, is the founder and CEO of MedStart. Harpreet Singh Rai is the CEO of Aura and a member of its board. Dr. Jim Flatt, who just had the pleasure of listening to CEO Brightseed, who gave us our keynote.
One of the things we have not yet seen, but I think we do expect to see some improvement, are success rates ultimately in phase 3 trials. And one of the biggest impediments and biggest issues has been the occurrence of sort of off-target or side effects that depending on the nature of the drug, if it's more to be used for chronic treatment, for example, a diabetes drug, the safety profile has to be pretty good, because in that case you're much less willing to tolerate side effects than if you are treating cancer. And so I think the big data AI, coupled with much more extensive knowledge of omics data that we can collect from patients, is going to give us the ability to start to understand in earlier trials where potential risk may exist, and perhaps even inform strategies to attenuate it.
If we look at the functional tenets of the data being used, right, with heterogeneous patient data, we're able to go into the FDA without more powerful, portfolio of assets that have more critique validation towards the actual individual patient populations that the drug would be developed for. And I think extrapolating from that either RWE, real world evidence data, and heterogeneous data right off the bat can really reduce and mitigate clinical failures in the FDA pipeline, so that we're not in this functional paradigm of taking 10 years and spending $1 billion on asset development, but rather we have the emergence of these computational bioplatform companies that have multiple shots on goal with great data, and to really bridge that gap from the in vivo translational efficacy into the clinic, and then ultimately getting that therapeutic to market that impact that patient population.
Greg Rotenberg, the CEO of SmartWire. Brad BOGOLEA, who's the CEO and co-founder of Simbi Robotics. We have Dr. Chess Stetson, who's the CEO of D-Risk. We have Michael Ginsberg, who's a Doctor of Engineering Science candidate at Columbia University, specializing in solar energy grid integration and renewable hydrogen. We have Bob Healy, who's the CEO of Mana Drone Delivery. We're fortunate to have a VC panel of expert investors. Please allow me to quickly introduce them. SERGEY, founder of the $100 million Longevity Vision Fund and sponsor of Longevity XPRIZ. Martin Dober, SVP and Managing Director at ID Ventures. Eric Martin, Venture Partner at Wavemaker 360 Health, Southern California's leading healthcare venture fund. Mark Toman, Managing Partner of Spiral Sun Ventures. Sri Muthu, CEO and Managing Founder, Health Venture. Dr. Sharad Mishra, Investment Advisor at MedStarter Ventures. Dr. Yoon Lee, Managing Director at BIC Technology Venture Development. Granville Ungerleider, President and member of the Executive Committee at NSIP, the GP of Ellington Healthcare Asset Management. Please allow me to now introduce Richard Hanbury, founder and CEO of Sana Health, a neuromodulation platform for pain and mental health relief. He developed the technology behind Sana to eradicate his own life-threatening pain problem following a spinal cord injury from a Jeep crash.
Really like the direction for pain management because it's huge market and much needed.